Welcome to this webinar. This month's webinar, we thought we'd hand over to HR Solutions, one of our partners, to talk about managing mental health in your network. So obviously it's a topic close to lots of our hearts at the moment. So I'll hand over to them to give a bit more of an introduction.
Thank you, Sarah. Thank you. That's lovely. And my name's Sue Watson. I'm the Head of Client Services at HR Solutions. And I have with me some of the team who are going to help work through the webinar with you. And we'll just talk through the housekeeping first of all. So, first of all, some introductions. So our main presenters today are going to be Dom Greenwood, who's our Senior Health and Safety Manager, and Victoria Templeton, our HR Knowledge Manager. They will talk you through from a health and safety and then an HR perspective. So it gives you the opportunity to ask questions on both areas, and all areas we should be able to help you. In the background, we've got a team helping us with some technical support. If you do have any challenges with hearing us, logging in or anything else, then please do message us and we'll try and help you. We do encourage you to ask questions throughout. We have got you on mute at the moment. It just helps with feedback and things like that. But we do encourage you to ask questions. If you put them in your panel, which looks something like this, and you can send a message to us, we will then fill them at the end. We will say we've had a question on this. We won't announce who it is unless you want us to. We would normally just ask the question and then share it with everyone, and then either Dom or Victoria or both will respond to it depending on what the topic is. We also want to make it as interactive as possible, so we've added a few polls, and when you see this sign, you know there'll be a poll coming up. If you the poll appears on your screen and you can just click to answer which option you want to answer. If you have it in full screen mode, sometimes you can't participate in the poll, so it's better to not be in full screen if you're going to take part in those. So onto the webinar. I'm going to hand over to Dom first of all, who I think is going to take over next. Let me just switch things over to him.
Okay, good morning, everybody. I'm hoping you can see that the agenda that's just come up saying health and safety. If you can just confirm that, Sue, is that correct?
Yeah, all good.
Okay, well, thank you very much. Delighted to be invited to this webinar. And just to give you a little bit of background on myself, my role within HR Solutions, as Sue has already said, is Senior Health, Safety and Environmental Consultant. But prior to undertaking that role, I was actually with a franchise organisation for nearly 10 years. The Energy Fitness Group, which you may have heard of, the UK and Europe's largest fitness franchise. I was head of their safety and compliance for a period of time, so I'm quite familiar with how the franchise model works. Just a quick rundown of the agenda today, certainly for my part, is concentrating more on the health and safety side. So we're going to talk about an introduction to what mental health actually is, and as Sue and Sarah both said, it's a topic that's very close to us at the moment because of the different situation we're in, both nationally and globally. The impact of mental health, how you can protect your franchisee and those who work for you and them, different tools that can support mental health in the workplace and in the franchise network, something called the mental health first aider, which is a newly recognised qualification that a colleague can undertake to help support the mental health process in the workplace. Some tools to think about how you can build a positive mental health culture, and then just what the benefits of that mental health culture on a positive basis would be. So we've got a few things to go. Enjoy the next few minutes with me, and then I'll pass over to Victoria to undertake the HR side of mental health as well. So I thought it was interesting, and I think it'd be the right thing to do to talk about what mental health actually is. And as many of you will know, it's something that is to do with our emotional, psychological, and social well-being. It's something that's in and around us all the time. It's not something that we grow in and grow out of. We're born with it. And I think it's really important that we don't see it as a negative, even though it's often given a negative connotation. it affects how we think, feel and act, and also react to different situations. And depending on whether somebody has a positive mental health or unfortunately a negative mental health outlook, can then depend how they would react in certain situations and certain things that are going on in society. Obviously helps us determine how we handle stress, day-to-day thoughts, feelings and emotions. Stress managed the wrong way can, as we know, lead to a negative mental health state. But stress is in and around us all the time with our workplace, with our families, different deadlines, financial worries, whatever it might be. So it's understanding how we relate to that and how we can make different choices. And I think it's important to talk about how mental health covers a broad range of different mental health problems. And there is a distinction between mental health and mental health problems or mental health illness. And there's at least 10, 12 to 15 different mental health conditions that we would normally talk about, and there's a number there on the screen. And you'll have heard of depression, anxiety, panic attacks, OCD, obsessive compulsive disorder, different phobias to a lesser or greater degree, bipolar disorder, schizophrenia, postnatal depression and PTSD are just a number of different ones that exist, and there's a few more as well. And obviously we're not going to have time to go through all those today, but if people are interested, there's further training and there are further things we can help you with. And as I've already said, it's important not to see mental health as negative. Unfortunately, this term mental health has become very much part of our vocabulary, and unfortunately on a negative connotation. We quite regularly hear people saying, oh, it's all to do with mental health. You know, they're mental. So poor mental health can lead to a mental health illness, and a number of those mental health illnesses are described above. So just giving you a bit of an introduction to what mental health is, and I'm sure you'll have already heard of a lot of that anyway. But there are some impacts of what mental health can do on a day-to-day basis. If somebody has poor mental health, it can stop them from functioning on a day-to-day basis with just general basic tasks and activities. And that could be from being able to get out of bed in the morning and undertake roles within the workplace or at home, to meeting deadlines, to being forgetful, to not really being able to hold down a successful relationship, and really just wanting to be isolated. So mental health can affect many areas of someone's life and have an impact on family, social life and relationships. I think that the big one here would be that if mental health conditions or mental health problems are not managed in the right way, they can then manifest themselves into physical health conditions, and certainly things like stress, depression and anxiety can then manifest themselves into different conditions and can have a physical effect. So whilst they are separate, there's definitely a correlation between mental health and physical health as well. With regards to working, people that have negative mental health or mental health conditions or illnesses often have a difficulty securing and then maintaining a job. So it's quite a well-known fact that obtaining a job is often difficult. And then I think that's twofold. It could be from the employer's perspective. If they then realise that the candidate has a mental health condition, they may not be as likely to employ them. But equally, it could be that the person doesn't present themselves or display themselves in a certain way that would be in keeping with the position. But then over and above that, it's then maintaining that position with regards to timekeeping, actually fulfilling the role, and all that kind of things as well. So there's different symptoms of why somebody with a mental health condition may or may not be able to hold down unfortunately. With reference to driving, and I'd also add into that operating machinery, more technical skills. Mental health conditions can impair someone's reactions and responses. So if they're, we all know that driving, you need to be on the ball 100% of the time. Unfortunately, some of the conditions that we talked about earlier will impair that person's responses. And certainly then if we add medication into that scenario, a number of the mental health illness medications unfortunately again affect people's responses and reactions. So it could be worth thinking about there. Thinking about parental responsibilities and obviously children as well. That can also affect relationships. It could be that the mental health condition is a response of the relationship. It could have been an abusive relationship, and also children, especially at the moment, we're all homeschooling. Some parents have got 2, 3, 4, 5 children. It may be that the other half of the partnership are still away working, leaving one person at home, having to homeschool a number of children. And as we know, we're not teachers, so it is a very stressful time for everybody. So it's worth thinking about how that can affect the parental responsibilities. And the last point here would be stigma. This is definitely something that could impact in the workplace. I work with a number of clients across the country in various different industries, and have come from, as I said earlier, 100-strong franchise network, and regularly heard negative mental health language used in the workplace. And I think there's a very fine line between having fun and banter at work, but then thinking about how that language may affect somebody that is struggling and is suffering. You'll have all heard of different mental health language, from someone being bonkers, or someone being nuts, or someone just being mental. There's a whole plethora of different words that can be used. So I think it's just worth thinking about how that negative language can then affect people who are suffering. A really great resource there, which is underlined, and I think this will be sent out as a PowerPoint and as a resource, would be the HSE work-related stress stats. The HSE, obviously the Health and Safety Executive, produce stats on an annual basis, and this is the stats from 2020, so just last year. So I'm not going to click on that link, but if you'd like to click on that, it gives some really good and really eye-opening stats on how the country is not only supporting mental health, but how many people just are suffering. And the first stat there is quite stark, that 828,000 workers in that year were suffering from a work-related stress, depression, or anxiety condition. And obviously the survey is completed across all different industries, from construction to farming to fitness to leisure to hospitality, retail, and everything in between. So there's a number of people, and don't forget, these are the ones we know about. There's a number that we probably don't know about in the workplace. Some big numbers there. Nearly 18 million working days were lost in that particular year, and they were put down to stress, work-related stress, depression, or anxiety. So if you could just think about the ramifications there, not only on government resources, but also your resources as a franchisor, having to replace those lost days, having to get extra staff in to cover the responsibilities, maybe having people off on long-term sick, the drain on your service delivery, depending on what franchise you're operating in. But again, I can speak pretty well of the fitness industry. A number of the clubs that I worked with only had what I call a skeleton staff, 4 to 5 colleagues. If 1 or 2 of those are off, puts a massive amount of stress on the rest of the team, but also the service delivery, and the end product isn't as good because they haven't got the resources. Mental health accounts for around 50% of all work-related ill health. So if you think about the rest of ill health at work, it could be an accident, it could be a chemical incident, it could be a fall from height. If you think about all of those, mental health is over half of all work-related ill health. So that's a massive statistic, with 55% of all working days lost due to mental ill health. Workload was the predominant cause of work-related stress, depression, or anxiety, and as we know, certainly at the moment and in the last 12 months, a number of people have had to pick up extra responsibilities because maybe somebody in the workforce has had COVID or is at home isolating. That then puts them out of the equation for potentially two weeks, but depending on their recovery, they could be actually out of the workplace for a number of weeks, if not a number of months. That then puts more pressure on other people at work. Home working as well. A number of people can't fulfill their role by working at home. So it's just worth thinking about the workload and how we're getting colleagues and staff members to pick up extra work. With other factors being lack of managerial support, organisational changes in the workplace, and just generally an uncertainty about how people feel about their role. And we know that redundancies are far and above where they should be and where they have been in previous years. But I think lack of managerial support is a good one. If you're a franchise owner, how do you support your franchise staff or your franchise network? It's worth thinking about whether it's contact, whether it's a call, whether it's acknowledgement, whether it's praise. What is that? And I think that's something that you need to probably think about. And interestingly, Michael Page, a massive recruitment agency, have again done a different survey, and they've come up with the number that 1 in 3 employees do not feel comfortable talking to their manager, which is interesting. That is generally about a mental health condition, but if 33% of your staff don't feel comfortable talking to you as either their manager or their network owner, then I think we need to think about how you can potentially change that so that you do have that confidence and that culture in the workplace. There's a number of different legislations and regulations where mental health will appear. And again, we haven't got time to go through all of those today, but certainly if anybody comes onto a mental health level 2 or level 3 course, we do go through these. But obviously the Health and Safety at Work Act is there. It's the primary piece of legislation in the UK that looks after all of our procedures in the workplace, and obviously mental health is a massive part of that, with the Management of Health and Safety at Work regulations, which is 1999, feeding out of that. We've also got the Mental Health Act, as you know, and the Mental Capacity Act as well. So there's a number of pieces of legislation, and again, as links, you've got the NICE regulations, the NHS and the HSE there as resources. So I'd implore you all to just have a little look at those. You're certainly not going to want to take that to bed for bedtime reading, but it is just it's good practice to have a good working knowledge of some of those regulations. So if you're asked by a colleague, franchisee, or anybody else in the workplace, you've got the ability to look at those, and they all contain downloadable resources, so you could print those off and you could have them as a resource for yourself or your managers or your group managers or however you're set up. So that brings me to our first poll, and the question is going to be, do you think mental health is managed in your network? So what I'd like you to do is to think about your personal network that you belong to. I'm going to hand back, I believe, to Sue to talk about this and explain how the poll works. But the question is mental health managed in your network?
Yep, I've just loaded the poll up. So if you want to vote, yes or no, simple one. I think all the responses are in. So let's just close that and share the results. That is interesting. We've got 67% no and 33% yes.
Okay, yeah, it's interesting. So obviously for the 33%, great, really, really good. I'm probably more interested in the 67% that are saying no. So I think this is where we as an organisation can potentially help with some support. But I think what I'd ask you all to do is to go back to your franchise networks and just think about how you may be able to support anybody with a mental health condition, but also how you could think about managing that particular event really in your network. And we're going to come on to some different ways how we can potentially help with that. I think the main way that you could support that process would be to have a mental health first aider. And again, I'm not sure if you've heard of that role, but it's not an additional role within the business. It would be a role that somebody would hold already. Maybe it's somebody as a member of the admin team, maybe it's an operational person, maybe it's someone in the business section, but you've identified them as somebody that is professional. They're well liked maybe within the organisation, with the workforce, and they could hold maybe a structured conversation with somebody that is displaying mental health symptoms. Absolutely something you could do would be to have a mental health risk assessment. We can help you with that. There's a number available, and that would just really look at the different mental health conditions and what you would need to do in the workplace should anybody be displaying those, and just give you some idea of how you've assessed that risk within the workplace and the franchise network. And alongside that would be a stress risk assessment again, and putting it all together would be a WAP, which is a workplace wellness action plan. And that really is a nice suite of documents that you can use, you can roll out within the franchise network to help support the franchises and to show the staff and the workers that you've got things in place. You've looked at mental health conditions, you've looked at the amount of stress they may be under, you've looked at job roles, and you've produced a workplace wellness action plan. And again, it would be something that you would communicate to staff, and almost be proud of that you've looked at it and you're putting things in place to help them look at if they've got a mental health problem. Line management training. So over and above the mental health first aiders, there's line manager training, so that line managers would understand the constraints of a mental health condition, the different regulations that are around that you need to maybe think about, and just what you might need to do to display good practice within the workplace for mental health support. So I think line manager training over and above the mental health first aiders are definitely things that you need to look at, and there's 4 or 5 different tools there that would help you support life. Certainly the first aid for mental health would be the initial support provided to a person experiencing a mental health problem until professional help is received. There's various different aims of that particular role, which would really be about preserving the life of the person. Signposting is a massive thing that they can do for professional help, but also maybe more local support as well. Maybe look at providing counselling services, and this wouldn't be a role that you would maybe put in from the business, but it could be that you'd look for a partner in your local area, and certainly as a franchise network, it may be that you could bring someone on, a company on a more national basis, and could support all of the franchises. I was involved with, unfortunately, a death at site a number of years ago, and a local counselling service were fantastic and came in free of charge, spoke to all the family members, staff for over a 4 or 5 day period, and it was great. So I think look at who you've got around you, and maybe promote their services, because it could be that they're used if somebody's struggling. Technology is massive now, as we know. We're on a GoToWebinar call today. This wouldn't have existed a few years ago. Zoom and Teams are equally as prevalent. But there's a number of meditation apps around. I think when I did a little bit of Googling a few weeks ago, I found at least 25 that were free. Some are better than others. Some are quite basic, others are quite detailed. It could be that as a franchise network, you get behind one of those and you just roll it out across your different units, and you allow staff to access that. And again, depending on which one you use, it could be that they can input what they've done on a daily basis, how much time they've spent doing different things away from work, how they feel, what they've eaten, how much sleep they've had, and the app will give them different solutions or different ideas of how they can feel more positive, and different things they can do. We talked about the mental health first aider, but I would also advocate having a mental health champion. It could be the same person as the first aider, but I think it's quite nice to split that down. And again, it could be that as a franchise, you could have somebody from a head office perspective overseeing different units as the mental health champion. It could be that maybe each of the units have their own mental health champion, which could be the owner or manager, or could be the mental health first aider. And this person would really just look at resources, maybe keep notice boards up to date with mental health information, maybe look at social events, maybe try and keep people talking, maybe buddy up people who don't know each other, look after new staff when they first come on, that type of role. Going on from the mental health champion, have you got a central point of information for staff? Is there a notice board that staff can go to, not only that would have maybe health and safety and first aid information on it, but maybe some links to mental health charities, organisations, groups, counselling services, the app that we've just talked about, maybe some social events. So there's a central point of information for staff in the workplace or in the unit, where they can go and just access anything they need to. It could be that you run a WhatsApp group, it could be that you run an intranet, or you've got some other social media that you use to communicate. You may have something called Fran Connect, I'm not sure. I'm used to Fran Connect as a CRM tool for the franchise network. It could be that through a franchise management system, this kind of information could be pushed out from a head office perspective. And again, I'm more than happy to talk to anybody that would like to know more about that. Clearly communicated absence and health and safety policies. Do the franchisees and the network workers know about your policies and procedures, absence management, mental health policy, stress policy, WAPs, whatever that might be? Or is it just put in a folder and sort of archived on a shelf? I'm a real advocate of bringing policies and procedures to life. For me, they don't just belong on a page. They need to be talked about in meetings, in toolbox talks, at a group level, regional level, and a unit level. So I think bringing those policies alive is really, really important. So just moving on to the mental health first aiders, as we've already sort of broached earlier in the webinar, they are a central point of contact for anyone that would be experiencing a mental health problem. They would identify different signs and symptoms of mental ill health, and they can sort of start supporting conversations. They would know what language to use and know what questions to use as well, to gain the responses from the person. They can assess the risk of self-harm and danger to others, but also danger to themselves. And it's important to think about what happens to the worker or the franchisee when the lights have gone out at work and they've gone home. So, have we supported them on their journey home, so to speak, and signposted them if needed? And I think this professional support is really important. And as we've already said, it could be the local counselling service, but there's a whole load of other links and useful places that you could signpost those to, and it would really be that mental health first aid that could do that. And a big part of their role would be to reduce stigma within the workplace. And as we talked about earlier, we all enjoy some banter and fun and games at work, but it's when it crosses the line and makes the person feel isolated, victimised, and probably in some form discriminated against because they've got some sort of mental or physical condition. And what we really want the mental health first aider to do is to promote this positive mental health culture, maybe working with the owner or the manager or the senior management team or the franchisor. It could be that they're going to promote a mental health positive culture in the workplace. And if needed, they would be the person who would call appropriate emergency services and then follow up with the person to find out how they're feeling, when they might be coming back to work, and obviously liaise with maybe the family, but also with the owner or manager as well. So we're going to move on, and I'm conscious of time. I've been talking for quite some time, and obviously I need to get Victoria to do the HR part, but I just wanted you to think about possibly building how we build a positive mental health culture at work. And I think a real big important part of that would be to develop this mental health action plan and policy, which is transparent, available to everybody, and communicated through meetings, toolbox talks, and obviously available in hard form as well. Mental health training, we've talked about, maybe a mental health champion, maybe line manager training. That can be accredited, or it can be on a workshop basis, and also the mental health first aider. And it could be that you need to go back and look at how people's roles need to be adjusted to accommodate maybe the fact that a number of staff are either not coming back because they're shielding, or they've been ill, or that you've just given more people more responsibility, and how that would then impact their current role and also what they're doing on a day-to-day basis. And I think it's really important to publish the franchisee's commitment to mental health, and that could be from a franchisor level, that you cascade that down to the franchisee units, or it could be from a franchisee publishing that to their workers, but also potentially to their customers as well. And certainly, again, I can draw reference to the fitness industry. It always proud that we published policies and procedures to members so they could see our commitment to health and safety, mental health training, equality, and all that kind of stuff. And then think about maybe evaluating different causes of workplace mental health. Good mental health and wellbeing is one of the most important and valuable assets to any organisation. I think it's really important if we can evaluate the causes of what that could be, and think about maybe how we can eradicate those or just change things. And again, we talked about earlier, potentially having a dedicated space for different mental health information. A massive one really would be the owner, manager, and potentially franchisor spending more time communicating and getting to know employees. And certainly for new staff, there's nothing more invigorating having maybe the managing director, the owner, the chairman, the group manager, whoever it might be, come in and saying, hello, welcome to the organisation. When you can, shake their hand, fist pump, whatever it might be, and just saying, this is what we do here, and you're a massive part of the team. So that acknowledgement, praise, and encouragement can really build that positive mental health culture. Can you introduce networks, initiatives, and activities that involve mental health? And we've talked about maybe some social activities. There's a number of online challenges and games and things that you could potentially get staff to do out of work and become part of, so they feel part of something, because there's much of a feeling of isolation around people at the moment due to the situation nationally and globally, but also due to the fact that there's a number of redundancies around and businesses are closing and all that kind of thing. Access to health services, return to work schemes, and allow flexible working. Well, I think we're all having to do that by evolution. But how does that look when we go back to normal? Hopefully, maybe after the summer or next year. are you still going to allow flexible working for families? And I think we've all kind of embraced this culture now of working from home and doing meetings on Zoom and Teams and all that kind of thing. So it's how you then change that or bring it back or stay as you are as and when the pandemic, we hope, subsides and becomes more manageable. And I think where you can involve employees in decision making, and I think absolutely on a strategic level, you've got boards, senior leadership teams, and you potentially wouldn't have what I'd call ground staff workers involved in that. But I think it is good to have a working group where you maybe have one member from each department, maybe a cleaning operative, a worker, a group manager, an office admin person, the managing director, that would probably just meet on a maybe monthly basis just to talk about initiatives. This is the way the company's going, and they would then cascade that back to their teams. I think that works really well, gives the employees a sense of ownership, and they're part of the decision-making team. And I think encourage a new life skill. The company I worked at before allowed anybody that wanted to take part in learning a new language to do so, and they engaged with a local Spanish teacher, and our head office, out of 32 staff, I think 8 or 9 decided to speak Spanish, and 5 or 6 carried on the course, and they now can speak Spanish. I'm not suggesting you guys do that, but it could be that you could ask staff or workers, would you like to learn a new life skill? Is there anything we can support you with? We've found somebody locally that can do X, Y, and Z. It could be IT, it could be cooking, it could be fitness, it could be learning a new language. So maybe from a franchisor level, supporting a new life skill would be really important. Okay, so we've got our second poll, and the question this time would be, do you think your franchise network has a positive mental health culture? And again, I'm going to hand back to Sue to frame that, and I'll talk to you very shortly.
Yep, that's loaded now for you. Just giving it a few seconds for people to vote. Okay, I think most people have voted now, so let's close that poll and I'll share the results. So we have 100% yes. There you go, that's fantastic. A good sign.
I don't think I've ever seen that before, so well, I might as well just go home now then. Well, it's great news, and by the sounds of it then, that quite a number of the initiatives and tools that we're talking about today potentially are in evidence in the workplace, which is amazing. So well done, everybody. I mean, what I would say is keep that going. Think about how you can probably keep changing it and evolving it and making new things as well. There's a number of different reasons you'd want to create a positive mental health culture in the workplace. As you'll know, not only is it increased mental health awareness, but there's evidence to suggest there's correlation between the way people feel and the way they perform in the workplace. So improved productivity, teamwork, and morale. You know, you want to be the franchise that everybody wants to come and work at. You want to be the franchise that everybody wants to come and spend their money with. So attracting new job talent because you've got the positive team. You're going to get a better franchise reputation, less staff turnover, which will reduce franchise costs and reduce ill health, absences and turnover. So there's a number of reasons why you'd want to obviously keep that mental health positive culture going as well. I think that's it for me. I think I'm going to be handing back to Victoria to undertake the HR section of today's proceedings. I hope you've enjoyed the health and safety side of it. I'm more than happy to talk to anybody after the webinar. I think Sue's going to share details and take questions at the end. So thanks for your time. Enjoy the rest of the webinar, and I look forward to hearing from you soon.
Thank you, Dom, and good morning, everybody, and thank you for allowing us to talk to you today. So I'm Victoria Templeton, one of the HR Knowledge Managers at HR Solutions. And so for the last part of today's webinar, I would like to consider mental health from a HR perspective in looking at how it impacts at work, consider the balancing act that franchises have in juggling the needs of the business versus those of an individual. And we'll look at the relevant employment legislation because this is necessary to manage and understand any risks that may be associated. And then I'll share some thoughts on what adaptations can be made and share ideas on the tools that you may wish to introduce to manage mental health effectively and sensitively. And then before we close, we've got some useful links to share before Dom and I can take some questions if there are any questions from you all. So if we consider the impact of work itself, poor mental health does contribute towards sickness absence, and that's both short and long-term sickness. And we tend to class long-term sick as anything over 4 weeks. You then have the impact on performance, and we know that mental health can lead to difficulties with retaining and processing information. It can lead to procrastination and an inability to make decisions, and so this is how it can perhaps manifest in underperformance. And then workplace conflict, and I mean unintentional conflict. So if somebody is struggling with their mental health and continues to be at work, but their symptoms do start showing. For example, they might suddenly appear quite quiet, or they might be snappy, impatient. Then the impact of that on colleagues obviously can be negative, and that's how it can manifest itself, and potentially has the impact for conflict in workplace relationships. The Chartered Institute of Personnel Development produced a report called the People's Manager's Guide to Mental Health at Work, and they found that poor mental health is the #1 cause of long-term sickness absence. It found that 86% of respondents observed presenteeism, and that's where people with poor mental health continue to go to work when they are unwell, which can then lead to the performance issues that I've just mentioned. We then have further research, but this time through Mind, the charity Mind, and they carried out research and showed from that 21% agreed they had called in sick to avoid workplace stress. 42% considered resigning, and 14% said they had resigned. So mental health can lead to staff turnover. And 30% of individuals did not feel able to talk openly with their line manager if feeling stressed, and that links into one of the statistics that Dom shared in his section. And 56% of businesses wanted to do more to improve staff wellbeing, but didn't have the right training or guidance. So striking the balance to support mental health whilst protecting your franchise is always a very difficult thing to do, as this tries to illustrate. So it's important to strike the right balance so that your franchise can continue to respond to COVID-19 and any other external challenges, and continue to make sure that it's a profitable business. But then on the other hand, at the same time, it's necessary to ensure you maintain that duty of care that you owe towards the employee and look after your people. So people with mental health, may need access to occupational health. They are perhaps going to have more sickness absence. They will need adjustments to the role, workplace, etc., or they might need time to attend medical appointments. And this is a very tricky balancing act. Each franchise is different in terms of their context. So what's reasonable to one in terms of the support they can offer and the adaptations may not be reasonable to another. And so we'll come on shortly to understand more about the reasonableness in managing mental health, including what it means in the eyes of the law and why. So first, I want to just share with you the relevant pieces of employment legislation, and having this understanding will help protect your franchise because it will enable you to make decisions within the law and therefore avoiding employment tribunal claims. So we have the Employee Equality Act, of 2010, and this is the piece of legislation that prohibits discrimination. And if we think about mental health, in some cases it could be considered a disability for the purpose of the Equality Act. We then have the Employment Rights Act of 1996, and this is a wide-ranging piece of employment legislation and the key one for employing staff. So, for example, it ensures that employees have protection against suffering a detriment during their employment. It gives them the right not to be unfairly dismissed. It provides protection from them being dismissed, selected for redundancy, and from being made subject to any detriment for making protected disclosures, in other words, whistleblowing. and it gives them rights not to be constructively dismissed, and that is where an employee feels they are forced to resign in consequence of a fundamental breach of the contract of employment. We then also have the Data Protection Act and now the UK GDPR following Brexit, and these are both really important in absence management as you are handling sensitive personal data. And a vital step in managing absence, which I'll come on to talk about, is to seek access to somebody's health medical records. And of course, the Health and Safety at Work Act and the Management of Health and Safety at Work regulations, these are both vital in managing the employment relationship, which Dom has already outlined. So if we look specifically at the Equality Act, this legislation covers the same groups that were protected under previous equality discrimination laws. So, for example, age, sex, sexual orientation, and disability, just to name some of them. And so for the purpose of today's webinar, disability is the relevant characteristic for managing mental health absences, because mental health illnesses may be deemed a disability for the purpose of employment protection. Each case is obviously very different, but it's just to make you aware that mental health can be considered a disability under this piece of legislation. So the Act defines a person to have a disability if they have a physical or mental impairment, and the impairment has a substantial and long-term adverse effect on their ability to carry out normal day-to-day activities. So I've highlighted the key words in the definition because these are really important. So physical or mental, so that's just to make you aware that actually it does cover mental health illnesses. Substantial, so that's important because it must have more than a minor effect on the person. So it makes it more difficult for somebody to do something. Long term means something that has affected the person or likely to affect the person for at least 12 months. And with mental health, even if somebody has episodes lasting a few months and periods of not being affected, and you know, that all in all could still be deemed as a disability under the legislation, as long as it obviously you know, has that substantial effect. And lastly, it talks about normal activities. So these are your things that, you know, that we take for granted: going to work, shopping, getting up in the morning, getting dressed. You know, if mental health starts impacting on those, then that's another factor to consider on whether you think the condition is going to be a disability. So in terms of the Equality Act, then to protect your franchise, it's really important to understand your legal obligations when managing mental health absences. So if the condition was to be deemed a disability under the Equality Act, then your obligations would include complying with the duty to make reasonable adjustments, which I will come on to talk about in a moment. And there's the responsibility to not discriminate because of the disability. And there's several different ways in which discrimination can occur. So you have direct discrimination, and that's where somebody is treated specifically and worse than somebody that doesn't have a disability. You have indirect discrimination, and that's where perhaps a franchise has a particular policy or way of working that has a worse impact on those individuals who have disabilities compared to those who don't. And discrimination arising from disability. So this avenue protects workers from being treated badly because of something connected to their disability, such as, for example, needing to take time off for medical appointments. We then have harassment and victimization. So harassment is when somebody treats somebody in a way that makes them feel humiliated, offended, degraded, and they believe it's because of their disability. And victimization, when somebody's treated badly because they've made a complaint of discrimination under the Equality Act. Now I'm showing here some useful statistics from a report. So the Employment Tribunal and Appeals Tribunal tables for 2019 and 20 highlight the awards that have been made. So for that period, the average award made in regards to disability discrimination was £27,043. The median award made for that same period was £13,000, and the maximum award was £265,719. And it's actually worth flagging here that actually with any type of discrimination, whether it's sex, race, religion, disability, awards are uncapped. And what this just shows for this particular year, the most that they've paid out in one claim was 265,719. So it really is, you know, really important to make sure that you're doing everything you can reasonably to help support that employee, because it supports the employee and protects your franchise. So if we remember this slide again, this is illustrating the need to seek that balance, because not only have you got to support that employee and protect your business from any of those legislation breaches, but you've got to, you know, you've got to protect your franchise. And that's very easy. It's much easier said than done. And it's a very difficult balancing act. So I just want to spend a few moments to just share with you some of the considerations, you know, in terms of what is reasonable, because unfortunately it's not defined in legislation. So I mentioned earlier that what's reasonable to one franchise may not be reasonable to another. An employment tribunal will consider several factors in determining what is reasonable. So they'll think of, you know, the size of the business, the financial resources available, and the administrative setup. So I've jotted down here some bullet points that I think are helpful. So when you're sitting down with the individual and you're working out what adaptations may be needed, these are some of the things that you should be considering. So the extent to which the adjustment would ease the disadvantage suffered by the individual compared to somebody without the disability. The practicality implementation of that adjustment. The cost of making the adjustment as well, the extent to which the adjustment would disrupt the franchise activities, the financial and other resources available to the franchise, the availability of external financial support or other assistance, and the nature and size of the employer's business. These are really important because it's striking that balance, and we would always recommend keeping written records of your thought processes and your workings out. So here we'll just look at some examples of the adaptations that could be made. So it might be the working hours, and it could be that you've got somebody that's full-time, but actually they're struggling. So can you accommodate part-time hours? And it might not just be the number of hours, but it may be the hours, you know, and how they're worked. So if somebody is on medication that perhaps makes them groggy in the mornings, can you shift their start time so they perhaps start a little bit later in the morning? You know, there's thinking creatively about those working hours, and it's about listening to your employee about what their needs are. You may need to authorise periods of unpaid leave, provide dedicated quiet areas in the workplace to allow some kind of hot desking, so when that employee is feeling periods of stress, they can take themselves away. Time out of the workplace to attend counselling relating to the mental health, and perhaps support with managing workload and looking at the work activity. And adjust absence triggers, and I'll come on more about the absence processes shortly, but it's typical, most organisations will have some kind of trigger system for when formal meetings take place. Well, if we know somebody with mental health issues and they are covered by the Equality Act, they are they're most likely to have more absences because of it than somebody that doesn't suffer from mental health. So one adjustment could be to adjust those trigger systems, because that way they're not going to fast track through your sickness standards, the triggers, and get to a potential dismissal quicker than somebody that doesn't have the disability. And then finally, you could consider how you may be able to adapt the role, redesign it in any way, or if, depending on the size of your franchise, you know, is there opportunity for redeployment? As I say, it's about what is reasonable for the franchise, and if something was to be put in place that's detriment to the business, then you need to be prepared to explain and demonstrate why you feel you can't accommodate it to justify your actions should you be at a tribunal. So I'm going to look at now some of the tools from an absence management point of view to help. So there's the use of informal welfare meetings. These should form part of day-to-day management and allow you to keep you informed on the state of the individual's health whilst at work. Or they can be used to evaluate how the reasonable adjustments may be working if you need to try anything new. or it could be an opportunity for you to review the risk assessment that may be in place. And they are generally wellbeing discussions that should be held in private, and it's recommended that line managers again keep their own notes of those discussions. We then have the health and safety management standards. You may be familiar with these. They've been around a few years now, but they're sets of standards helping employees to manage stress in the workplace. And these standards are for demands, control, support, relationships, role and change. And it's about managing each of these areas to ultimately lead to effective management of stress at work. And you can work through these and review these in your informal catch-ups that you have with your members of staff. And then I mentioned a moment ago about accessing, occupational health, GP, medical specialists. And when managing mental health in the workplace, a really useful tool is to seek that medical guidance on the condition. Not only will this help the franchise to understand more about the health issues from a medical professional, but it will provide useful practical information on things you may be able to consider introducing to support it. And the important thing to remember is that we are not medical professionals, so having that guidance is crucial for protecting and looking after the individual. So from an absence management and legal perspective, then before any action can be taken on the continued future employment of that person, should absences start to becoming excessive and detrimental, then it is going to be necessary to take out that medical advice before carrying out any potential fair dismissal on the grounds of capability. We then have EAP, Employee Assistance Programs. This is really useful because it can support employees. It can provide access 24/7 to expert help and advice in confidence. And so whilst as a franchise they don't know the discussions and the content, they will know the usage levels, i.e. to ensure how effective that benefit is that they've brought in. Having a tool like this can provide access to help and advice, and it could, for example, shorten somebody's absence from work, or if somebody is still at work and trying their hardest to be at work, them utilising it might just make the difference to help them remain being at work. So it is a really benefit and powerful tool that can be available. And then there's of course the ability to put in place workplace adaptations. And I mentioned in the Equality Act, if the mental health condition is deemed a disability under the legislation, then automatically there will be a legal duty to put those in place. But of course, as I've said, what's reasonable to one business may not be reasonable to another. And it's thinking about those considerations that I spoke about. And using the GP medical reports, that will help you to get their medical opinion as to whether the health condition is likely to be covered by the Disability Equality Act or not, but ultimately it will be a tribunal to make that judgment. And then just in terms of finishing off the tools for managing mental health, I did touch on procedures, where absence becomes, starts to become detrimental. You are entitled to address mental health absences under your usual sickness processes. I know that can be difficult because it feels very difficult trying to carry out your normal processes when you're dealing with serious issues like bipolar, depression, anxiety, but you are entitled to do it. It can even be potentially a fair dismissal if you go right through to your processes, should the individual obviously go on to long-term sick to the point where the return is not possible in the foreseeable future, or where there continues to be sporadic, intermittent, excessive short-term absences. So when the level of absence becomes detrimental to the running of the franchise, you have to, or you have to keep that job open for a period of time, there will come a point where you need to address it. Treating everybody in the franchise the same way through your processes is key, because it ensures that you do not face discrimination claims. But you need to recognise when you have a legal responsibility to adapt your process, because the condition you're dealing with in that process is a disability. So you may have to adapt the process itself, or for example, you may have to take extra steps before you would ordinarily get to the position of dismissing. One reasonable adjustment I've already mentioned is to adjust sickness processes and the triggers to recognise that somebody with mental health, I guess if somebody has mental health, they're more likely to have more absences, and therefore if you use a Bradford factor or some other trigger system, then if we believe it's a disability because of the nature of their own condition, then look at adjusting those triggers. That way they're not fast tracking through your process. Formal processes help the franchises to find out what help may be needed and what adaptations may be required to the role to help that person. So I know, as I said a moment ago, it's very difficult to use processes to deal with such a very sensitive and difficult health issue. But it's striking that balance. There will be a point where, unfortunately, you do need to start having those conversations. And for both processes, short and long term, using medical evidence is going to be essential. And as I said, before any fair dismissal can take place, then up-to-date medical advice must be sought. But the key to how it's managed is around communication. And so finally, before I just move on to opening up for any questions, I'm just going to cover off some ways in which we can just make sure the process is supported more for somebody with mental health. And that's about having a more careful, supportive approach. It's about looking at the style of communication, so being particularly careful with the choice of words, like Dom said earlier on, the tone you use, and how you position your discussions. So it's letting the employee know that you do have their health at heart, you want to support and come from the angle of a welfare perspective rather than a punishment for having too much time off. And their absence is genuine and serious, and that's really important to let them know that there's, just by progressing through any of the processes, it does not mean that you do not think their health is genuine or serious, but it's striking that balance. Honesty and transparency are key, and if they're treated sympathetically with open communication and treated like adults, employees do generally understand where you're coming from, because ultimately you are running a business. So it's about being honest and open and that regular communication, and seek their input into how they feel their attendance could be improved, because ultimately that's what you're looking to do through any of your processes, trying to improve your attendance levels. Formal processes help consistency and fairness, and that's another reason, because you can't start treating people differently by not going through a process for one but going through a process for another, because that opens you up to claims of discrimination. And the difficulty is as well that having the conversation, which is really important, but you need to let them know about the long-term implications. You're obliged to let them know, because ultimately there is a long-term threat to their continued employment if they can't ever return to their role, or if their absence continues to be detrimental. So whilst it's a very difficult message to say, it's about how you communicate it, but they need to know through your processes and your company policies of the implications for how their health is to be supported and managed in the workplace. We've got some links here of some useful support areas. Copies of the slides from today's webinar will be shared with you, so you will be able to access these links and some key telephone numbers here. And I appreciate you staying on listening to our session. I have covered the HR aspect now, so I'd like to open up, see if there's any questions that you may have for either Dom or I, and I'll sort of hand over to Sue to see if we have had any questions.
Okay, yeah, we've just got one question, and or two, I think, but there's a follow-on from what you were just moving on to, Victoria, which was, how do you approach someone that you think has mental health issues? So I think it's actually, how do you instigate it in the first place?
It's really difficult, and so it's about, I mentioned the informal welfare meetings. So it is that welfare conversation to say, take somebody to a side in private, hopefully you've got that good relationship with them. And it's about, sharing your observations, so if you're starting to observe somebody, say, for example, is everything okay, Victoria? You seem quite quiet, or is everything okay, Victoria? You wouldn't normally respond to me in the way that you've just responded to me. So it's using something that you've observed to start it, remember it's a welfare, you've got the health and their interests at heart, and just ask, is everything okay? And surprisingly, that just might be enough to open up that conversation. Some people are private, and absolutely they will share what only they feel comfortable in sharing, but it's having that conversation. And you could, if they're not willing to open up, then just say, my door's always open, that we do offer an EAP, or you could get support through XYZ if you do want to talk to anybody. If they do open up, that's great, because then it's having the conversation around, so do you need anything from me at this point in time? Because obviously you don't normally talk to me like that. Obviously it's what can we do to help support you? So I guess it's all depending on the situation, but it starts off with that welfare conversation.
Okay, thank you. And I guess that's where sometimes having a mental health first aider in the organisation can help, because it's somebody independent of the line manager. And so another one, just slightly different angle, is so it's difficult as a franchisor to know what your obligations are, and if you go beyond your obligations, are you exposed in any way? And I guess we're looking at perhaps providing you with tools, aren't you, to support your network, and how they can, if they're the employer, manage their individual employees. It's the responsibility is on the employer at the end of the day. So
it's really hard, because also what's reasonable isn't defined, as I said. So it's having your framework in place and being comfortable that you've got the right framework in place. So your sickness absence process is set up correctly to help support and deal with mental health, as in all other absences. You have the right tools that we've gone through today in place, but each business is going to be different to what they need and what they can accommodate. It's very, very difficult, and that's why I put that slide around the balancing act between the franchise, protecting your business, because you've got a legal framework to operate in, and what's reasonable and what's not. And hopefully those pointers will help you go towards working out what is reasonable in the circumstance, and each case is going to be different on top of that.
And I think the franchisor, as an employer themselves, potentially will have responsibilities there, and then because they are the franchisor, they might want to put out opportunities, training courses, maybe run sessions like this for their network themselves, so they extend things like this, or share this with their networks, so that there's some pointers as to what they can do. That's all of the actual questions at the moment. If I've just got one we've put it as a poll, but it's actually asking you, how can we help you provide support to your networks? And we've just broken it down into mental health training, other health and safety training, HR training, or other services. So if you wanted some materials or pointers as to what you can do, then we're more than happy to help and to provide you with some information. So if I just post that now, so that if you are interested in us following up with you, we can do. We'll also be sending some information to Sarah to share with you as well, including a link to this recording and a copy of the slides. But yeah, if there's more we can do, we do run mental health first aid courses, both delegated, and we can run them in-house. So we could potentially run a course for a franchisor to invite its network to, and there's a certificate course, or it could be just guidance on what they need to implement, sort of something like this. So there are lots of options out there to use. If I just put that, launch that poll now. It's just distributed the poll. Okay, thank you. I think everybody's done. So I'll just close that now. If I just move on to show you just one or two other things that you may find of interest. We do run a whole webinar program, and they are all on the AFA site, on the events page on the AFA website. I've put the link on the slide there. So if you would like to join any of our future webinars on topics that are very hot at the moment, as you can see, we've got employment law ones and improving training and development. We've also got an IR35 one if you use contractors, and continuing with the health and safety theme as well. So we've got one on safeguarding, which may be of interest to some of you, and we also run safeguarding courses as well. And we're looking at general fire safety and data protection, and we're adding to them all the while. So as we add more webinars, I'll send the links through to Sarah, and she can post them on the events page to keep you posted. And just as I mentioned earlier,
fabulous.
Sorry, Sarah.
I just said fabulous. Yeah, they'll all be featured. So yeah, no, it's amazing how much support you put on, which our members can access.
Yeah, I just say if there's something that we've not put on that you think you need, then please feed it through Sarah, and she will let us know, and we will see what we can do. So if it's a topic you would like us to present on, as long as it's loosely related to HR or health and safety, but sometimes we work with a number of partners, so sometimes we can go wider as well. And so we do run this First Aiders for Mental Health qualification course, which is run by Dom. He's a qualified trainer in that. So let us know if you'd like to attend one of his courses. There's a link there on the slide to the delegated course, which I think we've moved to March. Is it, Dom?
Yeah, that's correct. It's in March now.
March at the moment. Yeah, but we're keeping an eye on lockdowns and things. Whether it gets moved again, we will wait and see. But because it's health and safety training, it is allowed to continue. So that one at the moment is still running, and you can register for that. And if you wanted to run one for your whole network, then let us know, and we could look at what we could do. And we do have a partner that provides EAPs. They're pretty good actually at checking what you've got in place already, because sometimes people have it attached to their life assurance. So if you do offer staff life assurance, do check your policy, because it might come with a free EAP scheme, because many of them do. And so they won't try and sell you an EAP scheme that's if you've already got one. But they can be a really low cost way of providing a really valued benefit. And then finally, you can register for newsletters, and we keep you posted with what's going on. There's a lot going on with Brexit, and as well as all the associated things with COVID at the moment. So we are trying to keep pace with everything. And finally, there's a slide that just gives a link to our inquiries. If there's anything, so you can help with, either feed it through Sarah, who will contact myself, and we'll try and sort something out for you, or you can come through inquiries and we will follow it up that way. We've just got one question, Dom. The cost of the course. Yep. Do you know it offhand?
Yeah, so if anybody wants to come to a delegated course, it's £109 per head. However, if I was to run it in the workplace, I can train up to 10 people for around £450 plus travel expenses. So obviously it depends where people are located, but obviously it's a much more of a cost-effective option to have me in for the day. It's a 6-hour course. We provide a book, and there's an exam and things like that. But yeah, so around £109 delegated, or around 450, 500 in the workplace.
Hopefully that helps. So we try and keep the cost down. We recognise it's a challenging time for everyone. So it's more expensive, obviously, on the delegated, because we have the cost of the hotel, the venue, and the food that is provided, and it's all done in a really COVID secure manner.
Yep.
So yeah, So any feedback you have, I say, if there's something we can provide that you feel would be interesting, please let us know. We will send out a short survey if that's okay, just to get some feedback on whether you found this useful today. And it just remains for me to say thank you. Thank you to you for attending. Thank you to Sarah for inviting us to do this. And to Dom and Victoria for leading us through some tricky challenges that we all have.
Thank you, everybody.
Thank you.
Thank you guys for all presenting. It's been amazing, really interesting, and really helpful, hopefully.
Okay, thank you.